I'm a savage. Yeah. Classic, bougie, ratchet. Yeah. Sassy, moody. Coronavirus!
Hi there. So welcome to our monthly Student Nurse Q&A Town Hall. My name is Ryan Safford, and today I am being joined by...
Hi, my name is Madison Smith, and I'm a second-year nursing student.
Hi, my name is Toby Oluwateo. I'm also a second-year nursing student.
My name's Paige, and I'm a second-year nursing student as well.
Hi, my name is Ihan, and I'm a second-year nursing student at Georgian.
Okay, great. So today we will be talking about hypertension specifically. We noticed that there was a need for this within the Barrie community as we had an outpour of questions from people. And so we have made this infographic. And it is now available on our website. It just kind of gives a nice overview of hypertension, the risk factors, and how it's managed. To start off, we have a question from Jen Weber.
Hi, my name is Jen, and my question is, what is hypertension?
Paige, could you tell us a little bit about what exactly hypertension is?
For sure. Hypertension is defined as a sustained blood pressure of above 140/90. There are two main types. We have primary and secondary. Primary that cannot be attributed to any other secondary health factor. In other words, it's idiopathic and accounts for 95% of hypertension case. This is the primary risk factor for developing cardiovascular disease. And then we have secondary hypertension, which is hypertension that cannot be resulted from another disease. This could be diabetes, renal failure, or chronic kidney disease.
Wow, fascinating.
Wow.
So now our next question comes from Kevin. He is concerned that he may have hypertension. How exactly would he go about getting this diagnosed, Madison?
Yeah, so I would encourage Kevin to reach out to his primary healthcare provider. In short, hypertension is diagnosed by multiple electronic blood pressure measurements. Usually it's a minimum of 3. This varies a little bit with agency, but Hypertension Canada kind of says that 3 or more is kind of our gold standard, and these measurements should be bilateral. We want to make sure the measurements are done both in the clinical setting and outside of the clinical setting, and this is just to rule out the possibility of white coat syndrome, and that's just actually an elevated blood pressure that occurs in the presence of a clinical medical setting. So we think of white coats like doctors, they cause anxiety and get blood pressure a little more elevated. But it's really great that Kevin brings this up because we are concerned about hypertensive crisis, and this happens when you have a blood pressure of 180/120 millimeters of mercury or higher. This is considered a medical emergency, and it's important that if anybody's experiencing this, that they get to their closest emergency room as fast as possible.
Yes, quite impactful. Toby, we have a question from Len. He's asking about what are some of the complications of hypertension.
Okay, so while hypertension itself won't kill you, it may lead to complications if it is left untreated. Some of these complications arise from the excessive pressure forced into the walls of your blood vessel, and the amount of damage that is done to the blood vessel is completely dependent on when you seek therapy and also when you start making lifestyle changes. Some of the complications that can result from hypertension are aneurysms, stroke, myocardial infarction, heart failure, chronic kidney disease, renal failure, and premature death and vision loss.
Wow. Now, Ian, we have a question from Avinash who would like to know a little bit about some of the lifestyle modifications that may decrease the risk of hypertension.
Sure. So one of the most important lifestyle interventions to reduce the risk of the hypertension is to exercise. This doesn't have to be all strenuous exercise every day. This could be something that's simple as walking half an hour 4 days per week. Second, you must reduce your sodium intake. You don't want more than 2,300 milligrams of the sodium per day. Third, focus on the stress management. The hormones that are released, for example, cortisol, it causes increase in heart rate and blood pressure during the stressful time. That can be detrimental to your heart and blood vessels in the long term. And lastly, you want to watch what you eat. The Mediterranean diet is rich in seafood, whole grains, and oils. If you don't like the sound of that, you may want to look into the DASH diet, which is more of the typical Canadian diet, but made healthy.
Okay, now we only have a little bit of time left, but our last question comes from Wendy, and she would like to know something interesting we all have learned throughout our research into hypertension. Paige?
Okay, I was surprised that different races are at higher risk for hypertension, specifically African Americans and Aboriginals. The reason for this risk is unclear, but some people believe that it's due to genetics or environmental factors. African Americans are at higher risk to develop hypertension at a younger age, as well as they are 5 times more likely to develop hypertension than the US average.
Yeah.
So one interesting fact about hypertension is that white coat hypertension prevalence is estimated between 9% to 30%, and it is more common in women. So I would suggest people to do some relaxation techniques to prevent white coat hypertension, such as meditations or the breathing exercises.
Okay, Toby, what did you learn?
So I learned about a specific complication that can occur from hypertension is metabolic syndrome. This is diagnosed when a patient has a minimum of 3 risk factors and out of a group, and the group of risk factors are high blood glucose, low levels of HDL, which are considered good cholesterols in the blood, high levels of triglyceride in the blood, large waist circumference, which is that apple shape, and high blood pressure.
Okay, perfect. Madison, what did you learn?
Yeah, I think what was most surprising to me was that in 2014, over 85 million prescriptions were filled in Canada for hypertensive medications. This totaled more than $2 billion.
Okay, and the most interesting thing I learned is that hypertension is called the silent killer because many do not know that they have it. It's asymptomatic. And that is about all the time we have. So thank you for joining us today, and we hope to see you again. Thanks.